Okay, I apologize for the lack of recording. I did not push the button yesterday, so we will make do with this. If you have any questions, please send me an email. All right, what are we going to do? We're going to trace the pathway of the cardiopulmonary circulation, name and describe the specialized circulatory systems, trace the blood and fetal circulation, list the types of blood vessels, identify principal arteries and veins, and describe some disorders of the blood vessels. Just to let you know, the nuts and bolts of this PowerPoint presentation are available in the course. You just go to the section Study Tools for that chapter. In that section with the flashcards and the memory games is this the base PowerPoint that I use that you can download and use as notes. All right, blood circulation. There are two major circulatory systems. We have discussed these two before, the cardiopulmonary circulation and the systemic, but we will also look at three additional specialized circulatory systems today. The first one, the cardiopulmonary, is the one that we know and love that takes blood from the heart to the lungs to be oxygenated and then returned back to the heart. And here is a diagram of this. Please pause this so that you can look at the flow patterns, just following the arrows from the heart to the lungs and back. I should say from the right side of the heart to the lungs, back to the left side of the heart. Systemic circulation. This is the circulation that leaves the heart and goes out to the body. Interesting to note, this is one of the best ways that your body can equalize body temperature. If you remember back from muscle system, that generates a lot of heat, but in order to distribute it evenly, the blood carries some of that heat to the rest of the body, not just oxygen and nutrients. Systemic circulation, this is highly stylized, but you can see the highly oxygenated blood leaving the left side of the heart, going out to the body in capillary beds where that exchange of oxygen and nutrients happens, and then returning back to the heart through the blue side, going back to the right side of the heart. Some of the specialized circulation systems. First of all, we have the coronary circulation system. Your heart is a muscle, and it needs oxygen and nutrients to come in and waste products to leave, just like any other muscle in your body. Here's some pictures of that system. You can see this on actual hearts, some of these greater arteries and veins. And please note that it returns to the right atrium through the coronoid sinus right here. It's almost like a little collecting pool, and then it dumps directly into the right atrium. In the Class Connect at this point we discussed arteriosclerosis and atherosclerosis. Atherosclerosis is a buildup of plaques in blood vessels. If that happens to happen in blood vessels that supply the heart with blood, that's when you get a heart attack. If your heart muscle is not receiving incoming oxygen or nutrients, it can die without incoming. Portal circulation. This is a branch of the general systemic circulation. What happens returning blood after it leaves many organs, especially in the digestive system, instead of going directly into the return blood to the vena cava, inferior vena cava, it will instead pass through what they call a hepatic portal. This hepatic portal will then filter through the liver. The liver will, yes, filter a great portion of blood from these sources to not only remove toxins, but also to monitor the glucose level. Here's a picture here where you can see that occurring. Even though this picture does not show it, probably the largest is this in the small intestine. The small intestine is one of the largest organs in your body, much larger than the stomach and or large intestines. And all of that will go through the liver. And in that case, yes, monitoring glucose as it is being absorbed by the small intestine, as well as removing any toxins. Not any, but some. Fetal circulation. A fetus has a very different circulatory system than, and when I say the word adult, I mean a human being that has been born. A lot of this changes within just a few hours after birth. Within a few months, it is completely developed into what we would consider a normal adult circulatory system. The biggest difference is you will get a blood in the placenta. Fetal blood comes not into direct contact with maternal blood. However, it is close enough for exchange of nutrients, oxygen, toxins to take place. After the blood leaves the placenta, it goes through this ductus venosus system within the fetus liver. You'll notice here it is highly oxygenated. After going through the fetal liver, it will enter the right side of the fetal heart. Notice it is the right side. In a baby and an adult, the right side is where the deoxygenated blood is. However, in a fetus, that's where you will find oxygenated blood. Since blood does not have to go to the lungs to be oxygenated, most of this is that what we consider the cardiopulmonary circulatory system to the lungs is non-functioning at this point in time. So to compensate for that, there is an actual hole in the fetal heart. And I'm drawing in green, and you may not see that. Let me draw in a more right here in the middle. There is a heart, a hole going from the right to left side of the heart. There's no need to go to the lungs. It's already oxygenated. This foraminal valve starts to close up within hours after birth and should be completely closed within a few months after birth. If it does not, then heart surgery will need to be performed on that fetus for it to survive. So if you're hearing about a newborn having to go in for heart surgery, this is probably the reason. From then on, the circulatory system for the fetus is very similar going out to the body. Just note that there are those two major differences. Blood vessels. There are three types of blood vessels. Arteries that take blood away from the heart. Capillaries that are the small, tiniest between the two types. And then the veins, which return blood to the heart. Main thing to note between these two different types, the walls of the arteries are significantly thicker, which leads to a smaller opening or lumen. That thickness is in the most part due to a very thick, smooth muscle layer. In addition, arteries also include a substantial elastic layer. And when you hear about someone having arterial sclerosis, hardening of the arteries, that's when this elastic layer no longer functions. It becomes brittle or weak. Now notice, veins do not have that elastic layer, and their smooth muscle layer is significantly smaller. The veins will have a much larger lumen, as well as the presence of these valves. These valves prevent backflow. Blood will go through, the valves will shut, and then as there is a decrease in pressure, instead of the blood regurgitating back down in response to gravity, those valves shut and prevent the backflow. Capillary bed, right here, your capillaries will be one layer of cells thick. This endothelial layer becomes one cell thick, allowing for the transfer of nutrients as well as toxins. And again, it goes with a concentration gradient to a great extent. There are pore spaces in some of these that will allow larger molecules to transfer across. And that depends on the location of the capillary bed. Here are some images, more detailed, of arteries. Please pause on these if you need to look at them in depth, but as a cross-section you can see those three layers. Major arteries, the ones that you will primarily need to know are, of course, the aorta leaving the heart, and then some of the major trunks like the brachiocephalic, the carotid, and then we get into your like your femoral arteries. So no, you do not need to memorize all of these up here. We talked about capillary beds. Here are some details about capillary beds and how they function. And again, you can pause on any of these that you need to. If you have any questions about any of them, please send me an email. And here is a cross-section of a vein. And again, the walls are much thinner. They don't have to withstand the pressure of the heart beating like veins do. And yes, you'll need to know the inferior and superior vena cava. Here is a map of the major veins in the body. And again, you don't need to memorize all of these. And some of them should be intuitive, such as the deep femoral vein. It's nearest the femur. That makes sense. Venous return. We talked about this a little bit, how it has those valves to keep the blood flowing in one direction. Also, what really helps with venous return is movement. That our bodies moving, our muscles contracting help that venous return. And so individuals who are very sedentary can develop a condition called varicose veins, where the valves are no longer functioning, and so you will get pooling in veins. We've finished the first section. Blood pressure. Blood pressure consists of both systolic and diastolic numbers. The systolic is the one given on the top. Diastolic is the one on the bottom. And for individuals who are concerned about their blood pressure, the one to be the most concerned about is a high number for your denominator or your diastolic number. So someone who has a blood pressure of normal, 120/80, this is the number doctors look at. If it gets to be high, then they start getting concerned. How is blood pressure taken? Blood pressure cuff is put on the arm, and it is constricted to the point where there is no blood going through that artery. A stethoscope will be placed here so the sound of blood going through the artery can be heard. The pressure will slowly be released until the point where blood starts to come through. Then the person noting or giving the blood pressure test will note the pressure that happens at. If they are normal or average, it will read as 120 millimeters of mercury. They will then continue to release the blood pressure cuff until they can no longer hear anything. Hopefully, that is about 80 millimeters of mercury when the blood is free flowing. Okay, what happens as your heart beats is you get an alternating expansion and then contraction. Remember, it's elastic of the artery as blood flows through it. And you can feel that heartbeat or pulse at certain points on your body, and those are called pulse points, and they should match fairly closely to your heart rate. And I'm going to have to continue this in the next video.